Well, hey team, it's our 24th Chess Challenge, the 90th Chess meeting. What's our open going to be?
What about a 90-year-old performer?
He's pretty good.
Or what about 90 performers?
They might be too good.
Let's do a 1990s song.
And now, welcome to the stage, the founder and host of the Chess Challenge. He's the man with all the answers, Dr. Bill Kelly.
Thank you. Well, welcome everyone. Thank you. My friends, my colleagues, my honored guests. We know you could have been anywhere tonight. You chose to be here and you made the right decision. We're absolutely thrilled that you're with us tonight. We're going to support and loudly cheer on our fellows, right? We're going to, of course, get the finest, funnest, fastest education review around. Several of you will go home with prizes. And most of all, we're going to be present, be together, and have some serious fun. Now, before we do that, two quick thank yous. First, for this wonderful week of education, joy, really these days, a much-needed sense of community that kind of feels like family. Could we have a few folks stand up? Our program chair, Dr. Sandy Karana, our president, Dr. John Howington. If you're on the 2025 Scientific Program Committee and all chess staff, please stand up and be recognized. Thanks for everything you did all year. And then next, you saw them, you know them, you love them. They do fellow events year-round. Could the Training and Transitions Committee please stand? And then I was talking to a few folks in the back. If this is your first chess meeting, just raise your hand just a little bit. Just a little bit. I'm kidding, I'm lying. You have to stand up too. Stand up. No, stand up. All right. All of you. So, wow, look at that. Officially, I'm telling you, officially, you're in. You are in. And we look forward to seeing you in Phoenix next year and every year. So thanks for being a part of this. Well, all right, the moment you've all been waiting for. I need an enormous welcome for the best of the best, our 2025 Chess Challenge champions. Come on up, team. Come on. Please share your names with us, starting with you.
I'm James Wachowski. I'm a third-year fellow at the University of Colorado.
I'm Jackie Kercheval. I'm a second-year fellow at the University of Colorado.
Chris Reese, also a third-year fellow at the University
All right.
of Colorado.
Save Rishan, first-year fellow at the University of Marshall.
Abdul Abdeen, first-year fellow at Marshall University.
Zakaria Laga, first-year fellow, Marshall University.
My name is Rishab Bansal. I'm a second-year fellow at University at Buffalo.
I'm Jessica Beck. I'm a third-year fellow at University of Buffalo.
I'm usually I'm a third-year fellow at University of Buffalo.
And weren't they good sports in the video as well? Very nicely done. All right. Now, you're already winners just by being on the stage. You earned this week at Chess. You're getting all these additional educational materials and courses from Chess. And in fact, the top 25 programs get that. So be sure to play the quiz this spring. You have a certain amount of celebrity status now, which is good. And even the third place team tonight is going to go home with a share of $9,000 in cash for your program. So again, you're already winners. Just try to relax and have fun.
For the program?
We'll talk afterwards. But just relax, and the clock up here goes really quickly. So try to slow it down and make every second count. Players, are you ready?
Let's go.
Judges, are we ready? Audience, are you ready? Then let the challenge begin. Middle team, Marshall gets to pick first. Let me go over the categories. For our first of 2 rounds, pregnant pauses, better for everyone, commonly uncommon, Space Invaders, and Type O Chicago. Marshall?
We will start with pregnant pauses 100.
So pulmonary issues in pregnancy for 100. Minute ventilation can increase more than 40% during pregnancy, primarily due to progesterone-mediated increases in this. $100 points. Colorado?
What is respiratory rate?
That is incorrect.
ERV?
Buffalo?
ERV?
That is incorrect. Marshall, do you want to take a chance or pass?
We'll pass.
All right, let's show it. It's tidal volume. Marshall, you still have the board?
We will go with pregnant pauses 200.
Affecting close to 8% of patients, this is the most common pulmonary disease in pregnancy, is this. Buffalo?
What is asthma?
That is correct for 200, and you're on the board. Buffalo, where to?
We'll do pregnant pauses for 300.
For 300, let's show it. It's a live challenge, everyone, already. Wow. It's Armageddon, so let's have some equipment, and my colleague, Dr. Subhani Chandra, come on out.
Thank you, Bill. Hello, everyone. All right, team, come on over.
And this is an intubation challenge. But, there's always a but, only 2 of you will be able to, okay, let's make way for equipment. All right, only 2 of you will actually be able to perform the intubation. So I'm going to give you a few moments to discuss which 2 it will be. The other person can provide moral support. And so take 5 seconds, decide which 2 it will be. All right, starting now. Team, is our equipment all set up in the meantime? Amazing. All right, team, who's it going to be? Who's it going to be? 2 of you. Wonderful. All right. So I'm going to explain the rules in a second. And actually, I do have a question before that. Are you right-handed, left-handed? Can you hold up your dominant hand, please? All right. Amit and Sujit, keep that hand up. Please secure all the hands that they will not be using.
What?
Okay.
Okay.
Both of them?
So you will only be able to use your non-dominant hand for this task. But don't worry, between the 2 of you, you still have 2 arms, so this is very doable.
So we work together? Okay.
Yes, you have to do it together. See, we're very nice. You can stay, provide moral support, you can provide verbal instructions, but you cannot touch the equipment. Okay, there are only 3 rules to remember. You have to use the video laryngoscope to intubate. Once you think you're in, you have to inflate the balloon on the ET tube. And third, you have to use the bag to give 2 breaths such that we can see the lungs inflate. All right, you will have 45 seconds for this task. Any questions? All right, team, are you ready?
Yeah.
Come on up. We have 45 seconds on the clock. Check. All right. I will ask you to put the equipment down, sir, until it's time to start.
Okay. Wow. Sure.
That's fair, no?
Yes, that's fair.
That's fair. Thank you. All right. Now, ready, set, go. Go for it. Great. Nice view.
This way, yes.
30 seconds. You have time. No, you cannot use your other hand. Put your hand behind. 30 seconds. 22.
20.
Do you want to bend
Keep
it?
trying.
Take the tube out, bend it.
Keep
Come on, cheer him
trying.
on.
Jessica, take it out, bend it more.
10 seconds.
10 seconds.
Yeah, this way, yes. I go this way,
Almost. All right, team.
Oh.
I'm sorry. Time is up. But shall we give them a big round of applause for this sport? Fantastic. Thank you, everyone.
Good job, guys.
Nice job.
It's hard.
It's harder than it looks.
Yeah.
And you may know this, but all 3 teams this year are first-time players, and you're all doing great. So thank you very much. And Buffalo, once you're settled, you still have the board. Where do you want to go?
We want to go to Type O, Chicago.
So you've had enough of that for a little bit? So Type O, Chicago, blood type, these are hematologic, oncologic questions. And you said for 100?
For 100.
For 100. Highly specific for this disease is a serum, Adams TS 13 less than 10. Colorado?
What is TTP?
That is correct for 100. You're on the board, Colorado?
We'll do Type O Chicago for 300.
Thank you for reacting, or I would have read the 200 questions. So 300. Okay. So according to the 2025 CHESS guidelines, this is the first-line treatment of a centrally located 2.5 centimeter lung cancer without other disease. Buffalo?
What is surgical resection?
More specific?
What is lobectomy?
That is correct. And thanks, Dr. Howington, for the reference. It's Buffalo, still you.
We'll go for better for everyone for $100.
So this is for really improving outcomes, reducing disparities, making things better. So for 100, in 2021, an FDA safety communication highlighted limitations in the accuracy of these devices. Colorado.
What are pulse oximeters?
In persons with dark skin pigmentation, correct, for 100. Colorado?
Could you do Space Invaders for 400?
Space Invaders, this mostly has to do with kind of invading the pleura. Okay. And you said for 100?
400.
For 400, okay.
Whoa.
They like that. It's exciting, isn't it?
You like a little chaos in Colorado.
Okay, so for 400, with both high sensitivity and specificity, the presence of this protein can confirm pleural effusion due to CSF leak. Marshall.
Beta 2 transferase.
That is correct for 400. Marshall?
Space Invaders, 500.
For 500. So due to the production of insulin-like growth factor 2, patients with solitary fibrous tumor of the pleura may have this paraneoplastic syndrome. Buffalo?
What is hypoglycemia?
Absolutely, for 500. Buffalo?
Let's do Space Invaders for 100.
Back to 100. I get misty too when I think of how surgical referrals are reduced with intrapleural infusion of these two.
TBA
Marshall.
and Dornase. TBA and Dornase.
TPA Dornase.
You get. Say again, Marshall.
TPA.
Okay, and? No, generic name?
Dornase Alpha.
Generic name?
Pulmonary.
No.
I'm sorry, that's incorrect, but it's only 100.
No.
I think that's time. So TPA, let's show it, and DNase, DNA ACE. Okay. So who has the board? Marshall still?
Space Invaders 300.
Down to 300. Okay, so we're looking for the most common organism causing shown empyema necessitans. Looking for the organism. Colorado.
What is actinomyces?
That is incorrect. Marshall or Buffalo, want to go for it? So that's time? Okay. So we'll show it. It's looking for tuberculosis. Who has the board?
Space Invaders 200.
This is back to you. All right, so we're going to close out this category. So this is the test and the cutoff of that test, the value for diagnosing chylothorax. Marshall.
Triglycerides 110.
That is.
Chylomicrons?
Hold on.
And triglycerides, yeah.
What's your, just a minute.
Triglyceride and 110.
Just a minute. What's your final answer, Marshall?
Triglyceride and 110. More than 110.
All right. You guys good? Okay. That's correct, right? And phrased in the form of a question. Okay. So that category's done. Where to? Marshall?
Oh, yeah.
Sorry.
Let's do better for everyone for 300.
Down to 300. To reduce disparities, the 2021 US PSTF guidelines expanded lung cancer screening eligibility by lowering the pack year smoking history requirement from 30 to this. Marshall?
20.
Say again?
From 30 to 20.
What is 20?
That is correct. Marshall?
Let's do better for everyone for 400.
For 400, let's show it. Another live challenge. Chess Chuck It, let's bring it on out.
Thank you, Bill. Hello again, teams. So Chess Chuck It is a two-part challenge. So why don't you join me out here, and we'll play part 1 first. So come on over, team. So part 1 is a charades game. I'll explain part 2 when we get to it. Okay? So one of you will be acting out the terms, and the other 2 will be guessing. So why don't you take a couple of quick moments and decide who's doing what. And meanwhile, audience, I'm going to ask for your help. You are fantastic at making noise. You can do that now, but when they're playing, I will ask you to be quiet so our teams have a chance to score points. Okay? All right. Who's going to be giving the clues? Amazing. Thank you. All right. So no sounds of any kind allowed. Okay? No coughing allowed. Nice one. Okay. They can't get one past us, can they? No. But try, though. All right. You only have to guess 3 terms. Okay? You'll have 45 seconds to do it. You can pass and come back to it. Obviously, try and get as many of those 3 as you can, because the number that you get correct will determine how many chances you have to score points in part 2. Okay. All right? Okay. Let's be at 45 seconds on the clock. I'll show you. All right, are we ready? 3, 2, 1, let's go.
Restless leg syndrome.
Yes.
Line kit. Ultrasound. No.
Medication.
Would you like to come back to it?
You can pass.
Dizziness. Syncope. Pre-syncope. Cataplexy. Narcolepsy.
You got it. 8 seconds. 7.
OSA.
All right.
Ask
Audience,
the
any
audience.
guesses what it was?
ECMO.
ECMO. All right. But you did great. So you got 2 terms correct. So you will have 2 chances to win points in part 2. Now, I'm told that the most exciting TV game show in the Midwest or in all of the land was the Bozo Buckets Grand Prize Challenge. So we're going to go from Bozo Buckets all the way to Chest Chuck It. Okay, team? You're going to stand right behind that red line, okay? Because you got 2 terms correct, you'll get 2 chances to score points. And the way you're going to do that is in a moment, we're going to give you balls, and you have to stay behind that red line and try and drop the balls in one of these buckets. They go from 100 points all the way to 500. And whichever is the highest point bucket that you get one of the balls in is how many points you get for this challenge. Okay?
500. Okay.
All right. Who's going to take the first try?
Try first.
You have 2 tries. 100 all the way to 500. Let's make some noise, audience. Give him some support. Unfortunately, Dr. Kelly, shall we give them 100 points for being such good sports?
Judges, let's do it.
All right. Well played, team.
All right. Marshall, where to?
All right, let's do better for everyone 500.
For 500, to improve adherence, reduce toxicity, and lower costs, Treatment guidelines for drug-susceptible tuberculosis recommend a 4-month regimen of isoniazid, pyrazinamide, and these 2 additional drugs. We need both. 2 additional drugs, 500. Marshall.
Moxifloxacin. No, moxifloxacin. Moxifloxacin.
Okay.
Hold on, your answer, please.
Rifabutin and moxifloxacin.
Judges? I'm sorry, that is incorrect. Colorado or Buffalo for 500? Want to give it a try? Waving it off. So rifapentine and moxifloxacin. Marshall, you still have the board.
Oh, for us? Let's do pregnant poses for 400.
Back to pregnancy physiology. The recommended minimum duration of anticoagulation for pulmonary embolism during pregnancy is 3 months and at least these many weeks postpartum. For 400. Nobody? All right, audience?
6 weeks.
Looking for 6 weeks. Okay. All right. Marshall, back to you.
Pregnant poses for 500.
Closing out this category, fluid shifts, electrolyte imbalances, thromboembolic events, and enlarged ovaries in patients undergoing fertility treatment are due to this complication. For 500.
Hyperstimulation syndrome.
Hold on, Marshall. Yeah.
Hyperstimulation syndrome.
A question? Phrase has a question.
What is hyperstimulation syndrome?
Yep. Okay, Marshall.
Let's do type O Chicago for 400.
So back to hematology oncology. A patient with non-small cell lung cancer, clubbing arthralgias, and shown findings has this paraneoplastic syndrome. Marshall?
Hypertrophic osteoarthropathy.
What? Say again?
What is hypertrophic osteoarthropathy?
All right, that was for 400.
Let's do type O Chicago for 500.
For 500, in patients with hematopoietic stem cell transplantation and this cause of hyperbilirubinemia, hepatomegaly, respiratory failure, defibrotide is the only FDA-approved treatment. For 500. Give him a second. Nobody? All right. Hepatic veno-occlusive disease. We can show it. All right, that was a tough one for 500. And actually, this audience, hasn't this audience been great and supportive? All right. Hey, John. John, can we give out just a quick audience prize with a camera pan? Could we do that? So it's going to be a beautiful, there you are. It's going to be a beautiful Seek book. Pulmonary or critical care, your choice. Cameraman, can you find us somebody enthusiastic out there? Find somebody. Where are they? Can we show them? Let's show them. Oh! You got it? All right. Let's pick somebody. Right there, that guy. That guy with the glasses. That guy. Yeah. All right. All right. All right, settle down, settle down. You're going to see Lisa over up front here after the show for something. Oh, there's Michelle. Thank you, Michelle. Okay, choose wisely. All right. Now back to this. Thanks, everybody. Where were we?
Better for everyone for 200.
Back to improving care, closing out this category. To better assess lung function, the 2022 race-neutral or GLI Global PFT formula includes just these 3 patient biologic variables, looking for all 3. Colorado.
What are age, height, and gender?
Judges, they give it. Yep, for 200. Standing height, age, and sex. Okay, Colorado, back to you.
Let's do commonly uncommon for 300.
So right in the middle, these are rare, more rare diseases. So for 300, pulmonary gas transfer and functional health status can be improved in the shown condition with inhaled granulocyte macrophage colony stimulating factor. Colorado.
What is pulmonary alveolar proteinosis?
That is correct, Colorado. What's next?
Let's do commonly uncommon for 200.
Up to 200, so the serum test and the threshold level for that test for diagnosing lymphangioliomyoma. Buffalo.
VEGF more than 800. What is VEGF more than 800?
That's it. All right, 200. Buffalo, you took control back. Where to?
Let's do commonly uncommon for 400.
So diagnosis in a patient with non-CF bronchiectasis. Marshall? Say something. Say something. Say something.
Bursotonicib.
What is it?
What is bursotonicib?
That is incorrect. Or I'm going to go back to the incorrect. I'm going to go back to the question. We'll reset. So diagnosis in a patient with non-CF bronchiectasis and a low or absent nasal nitric oxide measurement. For 400. Colorado?
What is Cartagener?
Judges? Meredith? Yes. All right. We're looking for PCD. They're going to take it. All right. Colorado, back to you.
We'll do commonly uncommon for 500.
So this subtype of WHO group 1, pulmonary hypertension, may develop life-threatening pulmonary edema. Marshall.
BVOD. What's BVOD?
With pulmonary vasodilator therapy. That is correct. 500. Okay. Okay, Marshall, 2 more for this board.
Uncommon for 100.
Lymphedema, pleural effusions, and xanthonychia. Buffalo.
What is yellow nail syndrome?
That's right. Let's show it. Very good. And if we could get scores up in just a second. Hold on. We have 1 question left for this board. Ready? Okay. So for 200, in a patient with lung cancer, hypoxemia, and hypotension, it can be explained by this shown finding. We're going to show it, probably this video over here. Marshall.
Pulmonary embolism.
No, stop. That's incorrect. For 200. And Colorado.
What is pericardial tamponade?
That is correct. Well, great job. Okay. Now we're going to do, let's hear it for him. Now we're going to play another board with twice the points, so it's still anyone's games. Do you want to tell us our points so far, our scores?
All right. In 3rd place, we have Colorado with 900 points. And tied for 1st and 2nd place with 1,200 points are Marshall and Buffalo.
Wow. So it's really anyone's game. Again, wonderful job. But judges, is it fair to say, is it time for our halftime giveaway? All right, let's bring up the slides. Halftime giveaway. All right, so you get a break for a couple minutes. So Oprah was a Chicago TV legend, you know, and she would give away some of her favorite things, right? But actually, I want to hear today from our Oprah for the Day program chair, Dr. Sandy Khurana. Come on up this way. Be careful, be careful. Perfect, welcome. Because what we're going to do is some of Sandy's favorite things. Okay, all right, good. So a few of you, based on those tickets, hopefully you have your tickets, will get a few of Sandy's favorite things. So Dr. Khurana, welcome. Now, a few months ago, I asked you, we had a conversation about your favorite things for apparently no reason. This was the reason. Okay. And you talked about, Saturday mornings and shopping with your sister, and that's all nice. But as far as tangible things, come on. You mentioned there was a hot drink that you liked. Hot drink?
Oh, hot drink, yeah.
What is it?
Saffron tea.
Saffron tea. And then you also mentioned, if you don't mind saying, a more potent beverage that you liked.
Chablis.
Chablis wine. Okay. So if you're winning tickets, let's see. Okay. If you're winning tickets come up after the show, you're going to meet Lisa down here, okay? So let's see. And wherever the numbers stop, those are the tickets that are randomly generated. Let's see. I think that's it. So those numbers are the winners. Can you tell them that they're winners?
You're a winner.
All right, good. And then Sandy, you mentioned something else that you like. They're adorable, they're cute, you like to play with them? Puppies. So look at your ticket. If you get a puppy, if your number comes up, and you have to take it back to your hotel room tonight. All right? What's that? No. You can't do that. That's not right. It's not appropriate. All right, we're not going to do that. Now, I hope you remember this. You said that you like seeing your friends. Please remember where you said you like seeing your friends.
At chess.
At the chess meeting. All right. And everyone's a winner. Everyone's a winner. And to carry that forward, we're going to give away some chess swag. So those numbers, some beautiful mugs, some sports hats, and things like that. Tell them they're winners.
You're a winner.
All right, good. And to keep the magic going, a couple more things. We're going to give away a 2026 full registration, okay? Let's see where the numbers stop. Wait. Hey, all right, that one. Tell them you're a winner.
You're a winner.
All right. And then finally, again, you're not very materialistic, but you appreciate the value of money. So the thought was that, it's 90th anniversary, right? We could give somebody $90, all right? And actually, it's such a special night. I think we can do a little bit better. Now, especially, let's say we do it so it'll be a split. Half goes to chess philanthropy, right? Half you get in cash. I think we could do better. Do you think we could add a 0 to this number? For somebody. Come on. All right. If the guys are back there, let's add a 0. No, I'm just kidding. All right. All right, ready. Let's see where it lands. Half to you, half to chess philanthropy. That's it, 261. Tell them you're a winner.
You are a winner.
All right. And Sandy, before we let you go, come on over here for a second with me. Hold on. You already got a seek book. I'm sorry. You can't win. Okay. No, hold on. So there's one message actually to you, Sandy, but to all our chess attendees. Let's see.
Greetings to Dr. Sandy Khurana and all the doctors at the Chess 2025 conference in Chicago. My name is Shankar Vedantam, and I'm the host of a podcast and public radio show called Hidden Brain. Dr. Khurana, your colleague Dr. William Kelly reached out to me because he says that Hidden Brain is your favorite podcast, and he asked me to share a few words of encouragement or advice. Now, I'm a journalist, not a doctor, but I know the profession you have chosen is one that takes not just intelligence and skill, but also tremendous grit and tenacity. The path you are pursuing is not the easiest, and with that in mind, I wanted to share this bit of advice. Remember to savor the good moments, the victories, both personal and professional, the small kindnesses of other people, and the kind and thoughtful gestures you perform that make someone else's day. Noticing these moments
your favorite
will provide
podcast.
the emotional support you need.
I'll get you the recording.
I wish you a wonderful conference and all the best to all of you from our team here at Hidden Brain.
Let's hear it for Shankar and Sandy Karan, everyone. All right this way. Be careful. All right. Wow. So this just in, form of a question and no brand names. All right, we got it. We're getting there. Our fellows everywhere respond to feedback. Board 2? Okay. All right, folks, double the challenge, double the points. Our categories are drop the mic, job hazards, the bean, Windy City, and XC factor. And our current third place is Colorado, so you get to choose first.
Let's do the bean for 600.
Okay, so the bean is that silver thing in Millennium Park, officially known as Cloud Gate. So these are going to be related to, these are going to be kind of renal, critical care questions. Thank you. Thank you. It was for 600, you said. All right. Microscopic hematuria and acute nephrosclerosis with onion skinning are classically associated with this emergency. Marshall?
Hypertensive nephropathy.
Say again?
What is acute hypertensive nephropathy? Nephrosclerosis.
That's incorrect. Anyone else? So, yes, Colorado.
What is malignant hypertension?
That is correct. So we're looking for hypertensive emergency or urgency. Colorado, where to?
We'll do the bean for 800.
In patients with acute renal failure and shown finding, this is the guideline-based first-line treatment. Colorado.
What is ACE inhibition?
That is correct. So these were scleroderma findings, okay? All right. Colorado?
Let's do the bean for 1,000.
Acute renal failure, interstitial nephritis, nephrolithiasis have been associated with this potassium-sparing diuretic. Marshall. Your answer in the form of a question?
What is spironolactone?
That is incorrect. We'll reset. Buffalo or Colorado? Hold on, quiet. No takers? Is that time? Oh, that's time.
Wow. Everyone's favorite.
Did you have a second? What were you going to say? That would have been right. That's good. So very good. But that doesn't count right now. All right. So where do you want to go next? Who has the board? Colorado.
Let's do the bean for 400.
For 400, in patients with hepatorenal syndrome who are hypoxemic, mortality has been shown to be higher with the use of this vasopressor. Buffalo.
What is terlipressin?
That is correct. For 400. Buffalo?
We'll go to Windy City for 600.
Windy City, these are questions related to PFTs and physiology. So for 600, the annualized rate of bronchiectasis exacerbations was reduced with this DPP1 inhibitor in the Aspen, Buffalo.
What is brensocatib?
Aspen trial, that is correct, for 600.
Cool.
Buffalo?
We'll do Windy City for 400.
Small airway disease missed by spirometry may be detected by this lung function test. Marshall?
What is FEF 25 to 75%?
That's incorrect. May be detected by this lung function test assessing resistance and reactance. Colorado.
What is ESCA?
Say again?
What is ESCA?
That's incorrect. It measures reactance and resistance during quiet breathing. We can show it. Our third team, or we'll pass? All right. Looking for oscillometry with that one. Okay. Colorado still?
I think it's Buffalo.
Oh, Buffalo. Okay, where to?
Windy City for 800.
Reduced rate of COPD exacerbations was seen with the use of this inhaled dual phosphodiesterase. Buffalo.
What is NC-frentine?
That is correct for 800. Go back at it. Okay. Buffalo.
Windy City for 200.
In a sarcoidosis cohort study published in Chest last month, this was the most common spirometry pattern. Colorado?
What is obstruction?
That is incorrect. Marshall or Buffalo? Marshall?
Normal.
Say again, as a question?
What is normal?
Normal is correct for 200. Okay. All right, Marshall, where to?
Let's do Windy City for 1,000.
Another challenge, but you get to stand right there. So who buzzed in? It was Marshall? Okay, well, great. So this is two truths and an AI. AI is a powerful tool that can help summarize and generate information and go through tough cases. It's getting much, much better, but sometimes it'll confabulate or hallucinate and give you some wrong information. So in 3 different disease categories, we're going to share with you some pulmonary critical care medicine trials. 2 of them are real. 1 of them may sound real, but has been AI generated. Okay? Yes. So you're going to have 45 seconds to find the one that's fake and not true in 3 different categories. And the points are going to go 200 for the first set, 400 available for the second set, and 400 available for the third set. And there's no penalty for wrong answers, right? And this is all Marshall. Okay. So shall we can we start our clock at 45 seconds? Okay, everyone, you guys ready? Everyone please be quiet and we'll stand by. And let's begin. I think the first one are ARDS trials. Which one of those is fake? Not real. Quiet in the audience. We're approaching 30 seconds.
The last one, breathe.
Correct. Next. COPD, what one's not real for 400? 20 seconds.
I will do with the flame.
What is flame?
No, it was flare. But next one. Weaning and sedation trials for 400. You have 8 seconds. Which one's fake?
First one, ABC.
What is ABC?
And that is incorrect, right? We're looking for drowse was fake. All right, okay. So we'll get back to our main board. They got 200, how many points for that? So you're up 200 points, and it just shows how much you have to keep an eye on that artificial intelligence. Okay. Marshall, the board is still yours.
The bean 200.
Closing out this category, in a critically ill patient with muscle loss, serum creatinine estimates GFR less accurately than this. Colorado.
What is cystatin C?
That is correct. 200 points. Colorado?
Let's do drop the mic for 200, please.
So mic is minimum inhibitory concentration. These are mostly ID and antibiotic questions. For how much?
200, please.
For 200. Trimethoprim, sulfamethoxazole, and dapsone are treatments for pneumocystis pneumonia, but shown can be triggered if the patient has this deficiency. Buffalo.
What is G6PD deficiency?
That's correct, for 200. Okay. Buffalo.
Drop the mic for 400.
Treatment with rifampin and isoniazid for latent tuberculosis infection is recommended for this duration. Buffalo.
What is 3 months?
That's correct, for 400. Buffalo, still you.
600, same category.
Let's show it. No, don't show it. All right, we can show it. We're looking for the organism, not the condition, the organism. Buffalo.
What is histoplasma?
Histoplasmosis is correct. Good, good. All right, Buffalo, stick with Mike or go somewhere else.
We'll stay with the same category, 800.
All right, for 800, in a patient with shown findings, septic shock, recent travel to the Florida coast, and hereditary hemochromatosis, this, Marshall.
What is Vibrio vulnificus?
That is correct for 800, Marshall. Very good. Okay, Marshall.
Drop the mic for 1,000.
Closing out this category, 1,000 big points. Sulbactam. Durlobactam is a novel treatment for hospital-acquired pneumonia due to this.
Multi-drug resistant Acinetobacter baumannii.
What is that?
What is, yeah.
Good teamwork. That is correct for 1,000. Okay, all right. Okay, Colorado.
Let's do, you pick. You saved us.
All right. Let's do, I can't even read what the second one is. Well, Job has airs.
Job has airs.
For 400, nice.
So for 400, let's see, these are occupational lung diseases. So the predominant cell type, we're looking for the cell type, in the bronchoalveolar lavage fluid for the most common cause of the shown head-she sign. Colorado.
What are lymphocytes?
Lymphocytes for hypersensitivity pneumonitis is correct. Colorado.
We'll do job hazards for 6.
Now that one we can show. I'm so excited. Another live challenge. All right, hold on.
Oh, no.
Now this is very exciting. Could we have a program director, and if the program director is not available, someone who loves their individual teams, just 3. Come on up over there. And hold on, this is the best part. Ready? Okay. Bring out the knowledge dump. Carefully.
Careful.
Please be careful. Please be careful. All right, teams, where are my players? Where are my players? They're going to be setting up over there, and nothing for you to worry about over there. It's just your program director, and we're looking for the Colorado program director in the seat, okay? So it's going to be, now team, okay, good.
I'm so glad we got to do this.
Can we have
Now hold on, players.
come up
We're gonna set this up a little bit. So this is just for you, Colorado. We're going to ask you 3 questions, and the category is kind of RV there yet, pulmonary hypertension. And Subhani, can you make sure everyone's safe over there? I'm a little nervous. All right, but we're going to go, and the questions are worth 200 points each if you get them. No penalty if you're wrong, right? No penalty, right? Correct?
No penalty to us or to...
Nope. Oh, there's a penalty to your program director.
Just want to clarify.
There's a penalty for your program director. But they don't lose points, right? Judges? Okay. So you can win, it's 3 questions, up to 600 points. And I'm sure it'll all turn out okay, okay? You can peek if you want. But if you get them wrong, the knowledge dump starts to dump, okay? What's your program director's name?
Tristan.
Tristan. Hey, Tristan, before you bundle up, do you have a cell phone or papers you want to give to somebody else? You're okay? You can hand it off to Amick? Okay.
It also doesn't.
And he's kind of tall. Please be careful. Okay.
Bill, shall we call up the program directors of the other 2 teams too? Support?
Come on up. Come on up. Where are you?
Come on up.
All right. Maybe they can, well, they can't hold the ropes, but they can be close. Okay.
Bill, are you going to tell them what's in the bucket?
No. I don't think we should spoil it. Okay.
Come on, Bill.
All right. You know, convention center rules, you can't do water, but a 60% colloid solution that's mostly sticky is allowed. Okay. All right, we're all set over there? Okay, thank you.
All right, you can help with the dump.
I love how I love how the other colleagues are glad that their teams did not get the question at this point. Okay. All right, but it's all fun. It's going to be okay. So, can we do our questions, folks? All right, Colorado only, bring it in. Your first question. For patients with group 3 pulmonary hypertension associated with interstitial lung disease, the only FDA-approved therapeutic agent is this.
What is inhaled treprostinil?
That is correct. Whew. 200 points, and your program director is fine. All right, second of 2 questions. This is the only agent approved for inoperable chronic thromboembolic pulmonary hypertension, as well as for pulmonary arterial hypertension.
What is Resig-1?
That is correct.
Woo!
Now, this took a long time to build in the garage, so even though you got it right, team, carefully, let's dump just a little knowledge. Stop. Next level, okay. All right, team, that was not your fault. One more question, bring it back over here. So, third and final question. In a 2025 New England Journal of Medicine study of patients with PAH on maximum background therapy, risk of death was lower with addition of this drug, which inhibits activin signaling. Your final answer?
What is sotatercept?
That's good for 200 points.
Wow.
And I am, I was kind of nervous. I was so glad I didn't have to say, I'm so glad I did not have to say, dump the knowledge. Dump the knowledge. All the way, hey! All right.
All right.
All right, thank you.
Well, let's have another
Sivani?
round of applause for our program directors. And before you leave, how about a quick word to your teams?
Keep up the good work.
I'll give you a minute.
I'm so proud of you guys.
Oh.
Thank you.
All love.
All right.
Fantastic.
Well, thank you. Great sports, and well done, Colorado. You still have the board.
We'll do job hazards for 800.
Diacetyl added the flavor and aroma of butter, but also caused this lung histo. Marshall.
What is Silofeller disease?
That is, judges, that's incorrect. It also caused this lung histopathology in microwave popcorn workers. We can show it. We're looking for the histopath. For 800 points, we'll give the other 2 teams a couple seconds. Anyone? I guess that's time. Audience? Looking for bronchiolitis obliterans? Okay. Colorado, still you.
Let's do job hazards for 1,000.
An aerospace industry worker with dyspnea, cough, shown X-ray, and a positive beryllium lymphocyte proliferation test will have this lung histopathology in addition to fibrosis. Again, looking for the histopath for 1,000 points. Colorado?
What are non-cascading granulomas?
Just like sarcoid, that is correct. Colorado, where to?
We'll do job hazards for 200.
Closing out this category, so this non-uranium occupational exposure in uranium miners is a known cause of lung cancer. Hold on, audience.
What is radon?
Correct.
Right here.
Last category for 200, please.
Sure. Now, I forgot, I don't, John or Amick, our sound person, I wanted to mention that, I don't know if we could pull it up, Emil, but if you didn't get a prize or you don't end up with a prize tonight, you can just write your email on the back of your ticket, leave that up here on the table or over here for Lisa, and you could be entered to win one or more of some nice consolation prizes, including some celebrity voices for your voicemail. All right, could we play one of those if it's ready, or I can come back?
Yeah, this is Neil Friedman, incoming chess president. The person you're calling is very busy, so please do not bother them. Have a good day.
All right, thank you, Neil. Thank you, Neil. All right. And where were we? 200, you said, right? Okay. XC factor, Roman numeral 90. These are related to the chess 90th anniversary or things that happened 90 years ago. So for 200, you said.
Yes, please.
90 years ago, this pulmonary disease was very prevalent. In fact, it led to the foundation of chess. Colorado?
What is tuberculosis?
TB is correct. Colorado?
We'll do XC factor for 400, please.
90 years ago, the first cases of lung cancer were described that were attributable to this exposure.
What is tobacco smoke?
So Colorado, that is incorrect. Marshall or Buffalo? Hold on, any takers? So I think time is up, audience. This was going to be asbestos. Okay. Colorado, you still have the board.
Do 600, please.
90 years ago, the president of the National Puzzlers League coined the shown longest word in English, but this is now the more common, less specific term for pneumocono ultramicroscopic silicovolcanoconiosis.
Gesundheit.
Thank you. For 600, what's the shorter, less specific name now, or the newer name for this? Anybody for 600? No? All right, time's up. Looking for just silicosis. Much easier, much easier. Everyone's doing okay? Aren't they doing just a great job tonight, everybody? And I told you the clock runs quick. We're almost out of time. We need to give another Seek book away for this half of the game. So, John, can we get the lights up? Another camera pan? Beautiful Seek book. Can you find somebody for us? Let's find somebody. You find somebody. Where are they? Anybody? Audience, what do you think? Go around, go around. All right, bow tie guy, come on. Bow tie guy. All right, all right, all right. All right, bow tie guy it is. All right, security? Okay. All right, congratulations. All right, back to the game. So where do you want to go now?
800, please.
Okay, for 800, with penicillin restricted to only military use until 1943, the first commercially available class of antimicrobials was this. 800 big points, audience, quiet. Anybody? Class of antibiotics, early 90 years ago. Time's up, audience. Looking for sulfonamides was the class. Okay. Whew. All right, let's see. Subani, we're good. Judges, we're good. All right, so it's okay. We're going to do the last question of Chess Challenge 2025 before the final challenge question. Buzzers reset. Everybody ready for 1,000 points? Okay. 90 years ago, Alfred Loomis described wave patterns that led to the current classification of this physiologic process for 1,000 points. Hold on, audience. Give him a little time, audience. Hold on. All right, we're going to call it audience. This was looking for sleep, was the physiologic process. Okay, all right.
Okay.
So time for final challenge? All right, folks, so final challenge is here. Can we get an updated score for everybody?
Okay.
Hot mic,
And-
okay.
Yes. In
What-
last place, we have Marshall with minus 400 points.
Okay.
In second place, we have Buffalo with 4,200 points. And in first place, we have Colorado with 4,900 points.
Woo! And everyone's playing the final challenge, so you get to still compete. So it's 400, 4,200, 4,900. Is that correct? All right. So very exciting. Audience, we're going to need you to be quiet as well. Teams, you have a couple cards in front of you and some pens. One is for your wager card. Decide how much you wager, but wait till we show you the category. So we're going to pull up our final challenge questions from the back. The final challenge question is related to lung cancer treatment. Lung cancer treatment, think about how much you want to wager. And this is my chance to tell you that you in the audience, as well as people watching at home, are eligible to win as well. They're winning up here, but you're going to be able to be eligible for another chess registration to 2026 meeting in Phoenix. All you have to do, this is on X, you have to be the first to enter your answer, your correct answer, and you have to include the hashtag ChessChallenge2025, and our staff will find it and we'll be able to award you that registration. Okay, so you get ready to get the thumbs ready. Team, do you have your how much you want to wager for this category? Okay.
Check our math.
Okay. Your final wager? Your wager, please. Good? You're good?
Yes.
Okay. All right. So very exciting. We have, you also have pens to write your answers down. We're going to have the audience be quiet. Judges, is it okay to advance now? Judges ready or no? Okay. So audience quiet. We're going to show, let's do the next slide. You're going to have up to a minute to answer. So this medication significantly improved disease-free survival, EGFR mutated lung cancer after surgical resection, the ADORA trial, and then after chemoradiation in the LAURA trial. Again, the generic name, looking for the medication, and good luck. Everyone ready? You still have a little more time. Ready? Ready? Okay. Okay. Ready? Okay, hold on. All right. Again, you're already winners just by being on the stage. Let's hear it for him one more time. You folks did really great. We're all proud of you. Really, really well done. So, okay. Judges are validating. Okay to start moving? All right, so hold on. Is it okay to start going? Oh, hold on, stand by. What's that?
Networks. Network shadow.
Oh, of course. You know, this great question came from our network, right? Our oncology network. So thanks to all the network folks that you do amazing things all year. And in about a couple of weeks, once we recover from this, we're going to be asking you for great questions for next year's challenge. So thank you, networks. All right, thank you. Now we can go? Judges good? All right. So, Marshall, you had negative 400. Did you have an answer, a generic medication to answer this question, or no? Hold on. Hold on. Okay. May I? What is it? What was your answer?
Oh, actually, we don't have.
What was your answer? Yeah.
We don't have an answer. That's the answer.
Do you want to?
We know the answer, but we're not allowed to say.
All right, very nice. Let's hear it from Marshall. All right, very nice job today. Now, Buffalo was 4,200. Do I have that right? Okay. Buffalo, what was your final challenge answer?
Osimertinib.
Judges, let's show it. Let's show the answer. Now, Buffalo, what was your wager?
3,000.
Giving them 7,200. Is that right? Okay. All right, Colorado. So you came in at 4,900, correct? Colorado, what was your answer?
It was not that.
Okay. And how much did you wager?
3501.
3501. All right, good strategy. But congratulations, everybody. But it looks like, is Buffalo our champion this year? All right. Now, hold on. Nobody leave just yet. Who's our third place team? Marshall? Come on out here, Marshall. Marshall, stay right there. Thank you. All right, Marshall, everyone stand by. Get your partner over there. All right, hold this here. All right, bring it in. Let's hear it for Buffalo. All right, guys, nice job. Step over there. All right, where's our second place team? Second place, Colorado, right here. The checks physically get bigger. Okay. Colorado, wonderful job, right here. All right, bring it in. Awesome job. So proud of you for first timers. That's great. We have more stuff for you. Here, step over here. All right. Swing this way. All right. Don't go too far. All right, ladies and gentlemen, our 2025 final champions, Buffalo. Come on out, Buffalo. Oh my gosh. Let me get that thing. Oh my word. Here you go. Let's come over here in the center here. Come on. And the Training and Transitions Committee, bring it over here. All right, everyone up. You have to carry this home on the plane, the big check.
Okay.
Come on in, bring it in, everybody. Where is everybody? All right, bring it in, come on. So we're going to take some more pictures. The party's going to continue. But for the folks viewing at home, we want to say good night. Challenge yourself all year. We'll see you in Phoenix, okay? Bye, everybody. Thank you. Congratulations. Wow, you did it. I loved your video. Nice job. You did it.